Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome back, listeners, to Aging in Place Strategies and Answers. Many of you have heard me talk about open enrollment before, and perhaps you have also had experience of working with Medicare insurers or even in your own workplace. You've had to enroll in the newest health insurance that your employer is providing. And of course, that time frame is around the corner from us. Of course, I am not recording during the fall when that takes place, but I do want to bring some things on your radar so that when open enrollment comes, you are going to be prepared. So if you've not heard what that term is, then of course you can quickly Google that. But I want us to be thinking ahead for that time when we can make changes in our medical insurance. And the reason why I want us to be thinking ahead is because it seems like more large providers of medical services are refusing to accept certain Medicare Advantage plans or will not be continuing coverage for certain insurance products, and you may find yourself caught in this situation. In some cases, certain Medicare Advantage plans will not be offered in a state or a county. And in some situations, providers will not be accepted by large health insurance organizations. So if this has already happened to you or someone you know, please listen to today's podcast for some helpful tips and resources. Plus, be prepared to share this podcast with someone you know is in this situation. Now, my loyal listeners are pretty accustomed to my fall Medicare updates as we approach open enrollment. But with over 1/2 of all Medicare insureds enrolled in a Medicare Advantage plan, these changes can and they have affected thousands of people. Just a few days ago, it was reported that 90,000 patients lost in-network benefits when Anthem and the University of Missouri Hospital failed to come to an agreement. The University of Missouri Hospital could not remain in operation based on the reimbursement from Anthem, and Anthem felt that the new reimbursement rates that were being requested by the hospital system were not sustainable for their membership. Although other providers would still take Anthem in the Columbia and surrounding area, you cannot imagine how difficult this decision was on insureds as well as providers. Suddenly, as an insured, you don't have access to the healthcare providers that know you best. And the healthcare providers then have to ramp up to be able to cover thousands of new patients that now need to use their network. I have been working in healthcare a long time and now receive my own explanation of benefits from Medicare. And the explanation of benefits is the statement Medicare beneficiaries receive when a Medicare provider bills their insurance. On the statement, you can see the date of the service provided. You can see the name of the provider that provided the service, and then you can also see the amount charged. When you look over that statement, you're going to notice that even though the provider charged X, the Medicare is only going to pay their agreed upon rate, agreed upon rate for services and procedures. We usually call this the usual and customary rate. And if that provider accepts Medicare assignment, they agree to abide by the amount reimbursed by Medicare. So the next time you get a statement, if you've never bothered to look at that, you're going to notice the amount billed and the amount Medicare paid. And of course, then if you have a supplemental insurance, it goes to your supplement. But if you have a Medicare Advantage, then that is what they are going to get paid. Now, the health system is not immune from the rising cost of doing business, just like you and I are not immune from the rising cost that inflation brings to us in the form of groceries or services or other goods. The president and CEO of Scripps Healthcare says it has become a game of delay, deny, and not pay. And these are among the most commonly cited reasons for health insurers dropping certain Advantage plans or insurance plans. There are excessive prior authorization denial rates and slow payments from insurers. And so I bring this up so that you understand that this is not intended to be punitive or personal, but this is the cost of doing business. And when you understand that from a high level, you begin to understand the picture a little clearer, but it still is going to impact you. And that's where we're going to dwell today. From stateline.org, I read that many insurers are pulling their Medicare Advantage plans from counties and states that they've deemed unprofitable. Remember that Medicare Advantage plans are privately owned insurance companies, and so they can make those decisions. So let me repeat that for you, that many insurers are pulling their Medicare Advantage plans from counties and states that they have deemed unprofitable. Some reasons for low profitability in those areas were very slow repayment for care provided through the state Medicare program. Another reason was the cost of care for their insureds. Many of the patients that were on their rolls as insureds required high utilization of the health system in order to maintain or meet their health care needs. So while that may not describe your situation, this is what these insurance plans are seeing. Brown University School of Public Health professor Dr. Amal Trivedi says that when a contract leaves the market, so he's talking about an insurance contract, when a contract leaves the market, that can threaten continuity of care and access to care. The beneficiary will now have to choose a new plan, and each of these plans is going to have a different benefit structure. They're going to have different provider networks, different prior authorization policies, and different prescription drug formularies. The worry is that it's going to affect their out-of-pocket costs, expose them to catastrophic spending, or compromise their access to care. And I say, yes, that is true. This is the way we all feel when we hear these things going on. What do I do now? How is it going to affect my current health? How is it going to affect my future health and being able to access care? And what is the cost going to be to me, a senior who is on a fixed income? But be advised, it can also happen to anyone in a private insurance plan, even if you're still working. So let's use this example. You are the business owner. You have a business. You have contractors that you work with. You have contracts that you have created with them that have agreed upon rates. Now, you want to grow your business. So you, as a provider of this service under your business model, decide that you want to get new contractors in your network so that you can expand and enlarge those that you are able to touch with the services that you offer. But those contractors are going to only want to pay you 80% of what you typically charge. And so the question is, if you get more business at a lower rate, can you do that? Or after looking at your costs, would it be impossible for you to accept a lower rate while not growing your business? And this is what has been happening in the insurance business. And this is what is come to the forefront. This is what is opening this door because it's only natural for businesses to look at what they can do and what they can afford and the cost of business. And of course, we know that private insureds have a larger margin where they make money. That's their prerogative. They're in private business. Let's now pause for a word from our sponsor.
Do you want assisted living services but don't want to leave your home? Call Continuum at 314-863-9912. Our professional team has 20 plus years of experience and will help you create the perfect care solution that meets your current and future needs. Continuum supports independence at every stage of life. Call 314-863-9912 for a free consultation or visit us at continuumcare.com.
I want to give a shout out to Continuum for sponsoring this podcast. But now let's return to talking about medical insurance coverage and when you must make the difficult decision to get new coverage because your state or your county has dropped your coverage or the hospital system that you normally use is now not accepting your insurance. As I've mentioned before, I have a wealth of knowledge and experience, personal as well as professional, with Medicare. And I want you to know that amongst providers who bill Medicare, it is common knowledge that traditional Medicare is generally a better payer source than Medicare Advantage. So this is primarily due to the fact that when a provider bills traditional Medicare, the usual and customary rate is higher. Plus, there is less administrative burden on the office personnel who must get prior authorizations. So the administrative folks feel that they can move ahead with patient care quicker, that there's fewer denials of services, and there are less administrative hassles for providers. So that's a big deal. When I was in charge of marketing home health care. It was obvious when we looked at the amount of money we were receiving per patient under traditional Medicare and what we were receiving per patient from United Healthcare. And so at that time, we had to make some decisions. Do we continue to take Medicare Advantage and ask our contractors to take less reimbursement from us, or do we only take Medicare, traditional Medicare? And these are this is a situation that people find themselves here in 2025 as well. So let's get back to what we are talking about today, because I am thinking that many of us will go through this situation in 2026 as well. And also, we know certainly that some of you are currently experiencing this problem. So what will you do if you find out that your provider no longer takes your insurance? The first step you need to take when you hear that your provider no longer takes your insurance is to confirm this information with your provider. In other words, don't take your friend's word for it. Don't take the TV's word for it. But it's important that you confirm the information that you've been told with your provider as well as your insurance company, and then to note the effective date of change, because you do not want to get caught in this space where you thought that something was going to be covered, but now it is not. So confirm the information that you've been told. Also, ask if your plan has any grace periods, or if your plan has any continuity of care provisions that allow you to continue seeing your doctor temporarily at in-network rates, especially if you have ongoing treatment or a serious health condition. So, grace periods or continuity of care provisions that would allow you to treat at in-network rates. And while you think that's not a big deal, I know as a fact that this does happen, and you want to be aware if you can tap into that. And I think especially of those who have been going through cancer treatments or other in-office or in-clinic treatments for their health. The next thing you need to do is start exploring options. And the best thing to do is to contact your current insurance company for a list of in-network providers specializing in your needs. So just because you can't use a certain hospital system doesn't mean that everybody in your neighborhood has dropped this coverage. So find out who are in-network providers that you could contact. You could also go on the internet and check your plan's online provider directory, but make sure that's a current directory. And then you might want to call that doctor's office or that provider to make sure that they will accept your plan. The other thing you can do is to ask your current doctor for a referral to a trusted colleague within your network. You can also ask family, friends, what kind of insurance they have, and then who they might recommend to you. It is also possible that you have some telemedicine options until you are able to find a local in-network doctor. So don't forget about telehealth. It is still a real thing, and providers are still using it, and the door is still open to telehealth until Medicare decides to shut it down, which they were considering doing earlier, but right now it is still telehealth, or telemedicine is still a possibility. Now, is it possible that you could consider paying out-of-network rates? Nobody wants to do that, but sometimes you might have to do that until you move into your next form of coverage. And if you're going to pay out-of-network rates, is that financially feasible? until you do figure out what your next move is. Sometimes that's possible, and sometimes the costs are just too high. It is important for you to talk to the office manager at the doctor's office to see if they can negotiate a discounted rate for you until you're able to get into another insurance product. It is also considered a special enrollment period if the change disrupts, so the loss of coverage disrupts your access to care. A special enrollment period could be utilized, allowing you to switch plans or even possibly return to traditional Medicare. But Medicare will advise you if you are eligible for a special enrollment period. Medicare beneficiaries can contact their state health insurance assistance program, known as SHIP. And you can find this number on the Centers for Medicare and Medicaid.gov. So Centers for Medicare and Medicaid.gov. Others can reach out to their insurance company or a qualified broker for guidance on options and a possible appeal process. So reaching back to your current insurance company as your first step. But if you find that those doors are closed and this is happening, then I know that many people rely on their brokers for guidance as far as options and what products are now going to be sold in their county or in their state, and which hospital systems take those products. And then, of course, there's the appeal process. Let's take a moment to hear from another one of our sponsors.
The Neptune Society is the oldest and largest cremation service in the United States. For over 50 years, the Neptune Society has been proud to provide signature service to the families they've served. With a prearranged funeral plan, you can declare what you want done at the time of your passing, pay for it in advance, and not leave your survivors with the cost of your final arrangements. Call 314-266-2898. That's 314-266-2898.
Thank you, Neptune Society, for sponsoring this podcast. One of the advantages of a podcast like this that offers a wealth of knowledge to its listeners is to help you have fewer frustrations by gaining knowledge of what you need to know. Many Medicare beneficiaries do not know that there is an organization that you can call and communicate with. You would go to the CMS.gov website, and then what you are looking for is the Beneficiary and Family Centered Care Quality Improvement Organization. And this organization is funded by Medicare so that its beneficiaries always have access to complaints, to information, and to appeals. Now, every state probably has not every state, but there are certain groups of states that have certain organizations that handle those appeals and give out information. The names of those organizations that operate under Medicare are Levanta and Centra, and they help make sure that those who are insured with Medicare have a voice. So what you would do is you would go to CMS.gov, and then in the search, you would type in B as in boy, F as in Frank, C, and then that would take you to the Quality Improvement Organization. And then you would get the numbers that you would call for the state in which you live. Now, these organizations are designed to help Medicare beneficiaries with questions about quality of care received from a Medicare provider. And these organizations have a group of experts, providers, as well as consumers who are dedicated to improving the quality of care delivered to people with Medicare. Acentra Health and Levanta review complaints, work to improve effectiveness, efficiency, economy, and the quality of care a Medicare beneficiary receives. If you have been in a hospital or a rehab community and you feel that coverage is ending too soon, you might be informed by your case manager that is working with you that if you do not agree with the decision of your insurance company to end your coverage benefit period, or that it is time for you to discharge from hospital or rehab, you have the right to appeal. And then they will help you to get the paperwork that you need for the appeal. So on the medicare.gov website now, it says that you can file an appeal. But before you start, you need to ask your supplier or your provider for any information to make your appeal stronger. If you're in a Medicare Advantage plan, other health plan, or drug plan, check your plan materials or contact your plan for details about your appeal rights. The plan must then tell you in writing how to appeal, but certainly you can find your plan's contact information on your plan membership card. But Original Medicare allows you to file an appeal. And this can happen if you have not received a service, a supply, an item, or a drug that you think Medicare should cover. It also may be that you felt they should have paid for a healthcare service, items, or drugs. Also that the amount that you have been charged is unreasonable. And so certainly you can appeal that as well. Now, whether you're going to win the appeal or not is not up to me. It's up to the information that you're providing and knowing what the plan will go for. But I will tell you that people do appeal and lose, but by the same token, people appeal and win. So you can also file an appeal if Medicare or your plan stops providing or paying for all or part of a healthcare service, supply, item, or drug you think you still need. Your plan's drug management program labels you as at risk because you meet the overutilization monitoring system criteria. And so, again, thinking of where you will find this information, the Medicare beneficiary information is CMS.gov, and the information about the appeal was found at medicare.gov. And I will put that in the show notes so that you can look those up and access them for yourself. Now, if you need the State Health Insurance Assistance Program, you can visit shiphelp.org. And again, I will put that in the show notes, but they offer personalized health insurance counseling, and SHIPs are state programs that get money from the federal government to give free, local, unbiased insurance counseling to people with Medicare. If you have a trusted family member or friend helping you with a complaint, you can appoint them as a representative, which I appreciate because sometimes you're not feeling well enough to do this battle yourself. And that's been my experience. It's usually not the patient doing the appeal. It is probably the power of attorney or a designated representative. You also have the right to a fast appeal if you think your Medicare covered services are ending too soon. And this includes services you get from a hospital, skilled nursing facility, home health agency, comprehensive outpatient rehab facility, and hospice. Your provider must give you a written notice before your services ends that tells you how to ask for this appeal. And consumers appeal decisions all the time. And again, some are won and some are lost. But don't disregard the information or the not only the information, but also when the hospital or rehab or hospice representative says this is going to go into effect on this date. Here is your paperwork. Don't just stick it someplace, but take it and look at it and be aware of it. Because in my career, I have had many families who say, this has come as such a big surprise. And yet when you talk to the case manager, they said, no, they knew a week ago that this discharge was coming, or I told them 2 days ago this discharge was coming. I'm not saying that it is convenient and that makes it all right. Even though you've been told, it's still not a feel good, because sometimes only having 2 days to adjust to this news is not enough. But to fail to listen to advice that you have been given could cause you trouble. So whether you are going to be losing your insurance in the state or the county you live in, or if you find yourself in this situation where the providers that have been working with you for years can now no longer take your insurance, you must make a decision. And hopefully these tips that I have given you will help you to be able to sort out fact from fiction. And of course, it doesn't make us happy, but being angry and then not proceeding isn't a solution either. Now, at the end of every podcast, I provide a caregiver tip. So here's our caregiver tip today. My caregiving tip for all of my listeners, but definitely including caregivers, is to download the app that goes with your insurance. So many of you might have a Medicare Advantage plan, and unfortunately, the way the world works today is that there is an app that you can use to access information about your bills, about your coverage, and to easily see what benefits you have available to you. So if you have not downloaded the app for the medical insurance for the person that you're caring for as well as yourself, I would definitely suggest that. It can save you a lot of time. Yes, you will probably need to create an account, and yes, you will have to come up with a password, but it will definitely give you the ability to access that information quickly and easily. But do not assume that just because you might have United Healthcare and you have a Medicare Advantage plan, it will not have the same benefits as somebody who has United Healthcare but has a supplement to their traditional Medicare insurance. So I got on the app that goes with my health plan and was poking my nose around in the app to see what benefits were available to me. And I could see very quickly that the conversation I had been involved in recently did not apply to my insurance plan. So the app will help you to be able to see the benefits that you have. You will also probably be able to see what other products they have, or also to talk to somebody. So if you're in that situation where you really like working with that provider, then they can certainly help you connect with new providers in your area, or at least a medical specialty if needed. So unfortunately, this is the way of the world, having apps that go with our insurance products. Also, Medicare has been reaching out, and same with Social Security, to make sure that nobody can access or steal their medical information. So if you've been getting emails and letters from Social Security or Medicare about going into the online portal and strengthening your password or verifying that it is you, please don't fail to do that. They are not going to call you, so don't be scammed, but they are trying to strengthen their system so that there are fewer scams. And my other medical insurance caregiver tip is just be careful who you're working with. Just feel really comfortable that you're getting the best product for you at the best time of your life based on your health. And I say that specifically because of the new Medicare Guide program that came out that is for traditional Medicare recipients and is helpful in guiding those with cognitive decline into a better dementia experience by providing some real care navigation for the unpaid care support while offering respite benefits and more access to medical specialty and telehealth. So that, my friends, should help you to stay focused, and especially as we start moving into the open enrollment. And if you have found yourself at a loss of coverage, see if you qualify for this special enrollment period. And Medicare, as well as different unpaid organizations like that State Health Insurance Assistance Program, SHIP, can help you get that knowledge. Thanks for listening. When you visit hotorjustme.com, you're going to find an online store that offers products to help you through perimenopause and menopause so that you can be your best. If you're a listener of this podcast, please enter my special code, Aging in Place, and get 10% off your purchase. hotorjustme.com is a woman-owned company that supports women and the underserved. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com, for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own Aging in Place roadmap. As always, I value the time you spend with me.